of breast cancer as a woman's issue, but did you know men can be affected as well? This is On Call Off Script, a Jackson Health System podcast. I'm your host, Ruelle Champion, and we're going to discuss a topic that most would think only applies to women, but that's not the case. And we're going to go over it all: mammograms, risk factors, and what men need to keep in mind. Joining us is Danielle Fitzgerald. Thank you for being here, Danielle. Tell us a little bit about what you do at Jackson.
Hi, Ruelle. I'm the Director of Radiology Services at our Jackson North Medical Center location.
So let's start with getting the elephant out of the room. Do men really need to consider their breast health?
Simply stated, yes. They need to be aware that breast cancer is not just a women's disease. So it's important for them to be self-aware and know that although their risk is small, that risk still exists.
So what are the signs and symptoms specific to men that would prompt them to make an appointment?
So typically men don't do regular screening. So it would be important that they would be aware of the way that their breasts feel, so that if they got a lump, they would notice it and see their doctor. And then sometimes the symptoms would manifest as changes in the nipple. So the nipple can give a discharge, it can turn inward, we call that inversion, or it can simply itch. So they would be recognizing signs and symptoms that are changes for them.
Would they be noticing it in both breasts or one side over the other? What do you see commonly?
So commonly when we see male breast cancer patients, typically the lump and the symptoms are unilateral. There is a condition called gynecomastia, which is men can feel lumps behind both nipples is the typical location, and that's a benign condition, but they should be aware, either time. I mean, even if they were to feel changes and they had, symptoms of gynecomastia and it was both breasts, it would be important to see the physician.
And while we know this is something rare for men to even deal with in the first place, what are the risk factors for men? Is it like bloodline? Would you know if someone in your family had it? What are those different things that they need to know?
So for men, the risk factors are, not that different from women. For men, typically breast cancer manifests at an older age. So typically after age 60. You talked about genetics. Certainly if somebody has breast cancer in their family, that can increase their incidence of having breast cancer. But lifestyle things are important because those things are avoidable and they can help you reduce your risk. So you don't want to have a sedentary lifestyle. Drinking a lot of alcohol, a poor diet, obesity, all of those things are going to contribute. And also, uses of hormones. So if somebody's had radiation therapy to the chest, or a man is being treated with hormone therapy for, a different type of cancer, all of those things can impact their risk.
That was going to be my next question for you, Danny, if there's any diet or lifestyle changes that men could consider. I mean, I know a poor diet and lack of moving can cause a lot of different things, but were we saying that changing your diet, living a healthier lifestyle, making sure to exercise 30 minutes a day would make a difference?
Absolutely. Absolutely. And not just for breast cancer risk, every risk.
Right. So when we're talking to these men, we know that they have symptoms, that we know they have signs, and it's their first appointment at your department. How do we walk them through that process? What should they expect?
So for men that come, to have what we consider typically as women's imaging, first and foremost, often, they're very quiet, but, their doctors are going to send them for the same screening tests for their symptoms that a woman is going to have. So the first step, typically, they're going to have a mammogram. Okay, so men undergo the same type of testing, the same positions as a woman would undergo, and then often it's collaborative imaging with ultrasound. So we'll educate them. They're going to come to the department and the technologist is going to explain what they can expect. Most times they don't have a lot of questions, but it's a very straightforward exam for them, and they won't experience a great amount of discomfort.
Oh, that's great to hear, because I can imagine you're dealing with the physical issues, right, with possibly having breast cancer, but the mental stigma around it too may be difficult to make that first appointment or even show up. So how are we comforting them? Do we handle them with a little bit more care?
So we always have them, we respect their privacy, right? Because it's like, the way you put it is a very good way. They would be a little bit more uncomfortable and maybe just, maybe even embarrassed just because it's a different type of thing, you wouldn't be expecting to have, but they all do very well. Once they understand and, they've been educated, most times their physicians have made them aware. So they're looking really to have an imaging diagnosis at that point.
And once we reach that point of diagnosis, is it, I hate to put a generalization on all the different men that you see that deal with breast cancer, but at what stage are they at in this process? Do they tend to end up later on in the process or later on in the stages of breast cancer, or is it early enough to do preventative measures?
So normally the men, they are a little bit more advanced in the process, but they still have very good prognosis. So they undergo the same type of biopsies that women have to actually get the tissue pathologic diagnosis, and then they're treated, very similar. Their, excision is obviously less traumatic, than it is for a woman, because of, the way we think of our bodies and how we associate, ourselves with identity. But they do very well. They do very well. But they are usually older, and it's usually a little further because you're not expecting it.
Right. And while we know all these facts about men's breast health now, I think that doesn't discount kind of reiterating the things that women need to know. When do we start regular screenings? When do we start mammograms?
So the American Cancer Society is always going to be the guiding voice on, recommendations for, starting screening. So currently the American Cancer Society recommends that women start screening at age 45 with the option to begin at 40. And then after age 50 is every year. So we, as, women's imaging professionals, we recommend, of course, anytime somebody has a change, that you be seen.
Right. And that's so important to just reiterate, because we know the earlier you get screened or the earlier you'd be able to catch something like breast cancer, the better the outcomes are for being able to treat it. Is that correct?
Absolutely. The earlier that you pick up a symptom, you stay on your regular screening cycle, the earlier we find something, the better the prognosis.
And over time, since this is such a message we repeat every single year, have there been any advancements or any innovations in the technology that people would be interested in?
So there's always, efforts, because, the crusade against breast cancer, never ends. And it's the type of cause that people are really devoted to. So many, different techniques are always being developed. We're using contrast mammography now. The biggest thing is that you want to have always a tomosynthesis mammogram, which is we're using 3D technology. So this has been around for many, many years. Yeah. It's the only thing that we use in the Jackson Health System because it allows us to do both a 2D and a 3D view combo. And it becomes critical because it allows the radiologist to look at very, very thin slices. So we can rule out a lot of things that, say 10 to 15 years ago, we were doing, more views, and we had less conclusive imaging evidence of what a finding was, and now we can be more specific.
So it sounds like we're truly getting down to the details to make sure we can provide the best possible care for our patients.
Absolutely.
That's
Absolutely.
great to hear. One question, interesting one I may have for you is there a particular fact about breast health, specifically for men, that most people don't know or would surprise most people, besides the fact that they can have breast cancer in the first place, of course?
I guess there's not really anything, surprising that sort of jumps out at me to share. I think it's just that they just need to be aware.
Yeah.
And, that the imaging services are available to them. It's simple to be treated, and, they can have a very good prognosis.
One thing I know we didn't get to touch on this a little bit, but self-exams, right? I remember from a while ago, breast cancer runs in my family, and my mother taught me how to do a self-exam. Does that apply for men as well?
I think that body awareness is the critical, most important thing for anybody to protect themselves from breast cancer. It's important to touch your body. So while it's not something that we state that men should be doing a breast self-exam, maybe there's, the opportunity to reconsider that. But I think that, they should always be aware of how, their breast feels,
And-
because they are going to be the first person.
right.
It's not typical that a man goes in to have a physical exam and they undergo a clinical breast exam by their physician.
Right.
It's just,
You wouldn't.
it's not part of, prescribed care.
Right.
As opposed to when a woman goes for her annual women's wellness, they're going to have a clinical breast exam by their provider.
Right.
But we know that most lumps are found by the women themselves. So it stands to reason that it would be the same for a man.
Danny, one final question for you. Is there anything else that we didn't get to touch on or important information that we want to share?
I think it's important to share that as a Jackson Health System, we do have 2 locations that provide all of breast health imaging, and that is the Jackson Memorial Hospital location and Jackson North Medical Center. And we do have partnerships with grants, so we can do outreach to the community, to uninsured women, and we welcome the opportunity to take care of them.
Absolutely, because knowledge is power, and when they see you guys, they're in good hands.
Thank you so much. It's really been fun to be here today.
Thank you, Danny, for your expertise. All right, so straight from the source, when it comes to breast health, the issue is found in the tissue for women and for men. But the take-home message is that early detection really makes a difference. Thanks for watching On Call Off Script. Don't forget to follow our Jackson social media accounts at Jackson Health and stay tuned for our next episode.